Happy Twin Tuesday.
Happy Twin Tuesday. Whoop, whoop. Dr. Johanna.
Dr. Madeline.
And it is awesome to see you guys today.
Yeah, happy Tuesday.
Yeah.
Happy Twin Tuesday. As you're hopping on, drop some emojis, say hey. If you're catching a replay, say replay down below so we make sure we don't miss you. We love all of y'all who support us and tune in to learn some really fun stuff.
Absolutely. And we changed up the scenery a little bit today. We're back in the office at Atlas Chiropractic Center, which we are here to help serve you and your beautiful family, but our jam is pregnancy and postpartum mamas.
Exactly.
And we've been very blessed lately to see lots of little babies.
Yes.
And it's such an honor. It's like one of the best things that we get is that you guys trust us enough to touch your newborns. So it's amazing.
It is definitely one of the best perks of the job.
Yeah. So thank you for all your referrals, because that does help us and it helps us help you. So we're very thankful for that.
Yeah.
And we've been talking about the past couple of weeks different areas of the spine and how that relates to how you feel and how you function. So we're going to finish it off this week by talking about your low back.
But before we get there, we got to recap. So in case you missed the other ones, you know what we're talking about. So as chiropractors and what we do in the office and why this is important is because we focus on your spine and your nervous system. So your spine has two functions. It keeps you upright at your posture, and it protects that really awesome spinal cord. Your brain controls everything, right?
Yeah, your brain, it sends messages down your spinal cord, which is protected by that spine. And now from each individual bone in the spine comes your nerves.
Yeah.
And your nerves go to the areas and specific areas. So like in your neck, we talked about it. It goes to your neck muscles. It goes to your head and face. So that could control things like your ears, headaches, migraines, jaw symptoms. The nerves in the lower part of your neck go down into your arms and hands, so that can control anything in this area. Nerves in your mid-back go to that mid-back area, so those muscles into those joints. They also wrap around to the organs in the front, so that could be like lungs, heart, upper digestion, that kind of thing.
Yeah, as you're going, before we get to the low back, which is what we're diving into today, but we saw a new patient in the office yesterday who had never been adjusted, and Dr. Johanna adjusted that person, and when they had came up, the top thing is like, oh, what did you think? And they said, I can breathe so much easier and better already.
Cool. That's awesome.
So that's
one
pretty
adjustment.
cool. Yeah.
Yeah. So the ways that our spines get all kinked and jammed out of alignment, what will happen is they'll put compression on the nerve in that area where your joint is jammed at. So if a nerve's compressed, just think about like just how you can see here, my fingers like pinching it, that nerve can't work at 100%. So a lot of people know when that nerve's compressed, they have pain and discomfort, and that's usually what will drive you to your medical doctor, your physical therapist, your chiropractor, to the ER, something like that. And that's one thing that will happen, but the other part of those nerves control how your body actually functions. So by getting proper mobility back in your spine, taking compression off that nerve that's going to that lung or affecting that posture, compressing those lungs will allow for you to get more air in, allow for a deeper breath, that kind of cool stuff. So that's what we get to see, all kinds of things here in the office.
Yeah, so let's talk about low back. Like, where do those nerves go? What do they control? What might we see?
Well, the nerves in your low back go to your low back, so they control the joints and the muscles in that area. So if you're ever getting any low back pain, that could mean there's an irritation on those nerves there. That nerve also goes down, and it makes up your sciatic nerve, which sits right underneath your glute or your butt muscle, which a lot of people know about, and they'll get sciatic pain, which can stem from the low back, glute pain, and all the way down to your toes. So it can go all the way down that leg, or it can miss spots and show up in other areas of that foot. So that could be irritation of the nerves in the low back. Plus, those nerves go to the front of all those organs. So that could be things like issues with digestion, elimination, urination,
reproductive organs.
Yeah, more painful cycles, irregular cycles, that kind of thing.
Fertility. There has been, just so many stories that we've seen and from other doctors and in here of women struggling with fertility, coming in, getting adjusted, balancing out that body, and then ended up conceiving. So it's pretty, just really cool, like stuff that we do see on our side. I would say definitely with cycles, I've had a lot of people like, oh, well, like they get that low back kind of achiness, tension throughout their period, and adjustments can help with that as well. So.
Yeah. The other thing that we do see a lot of times is little kiddos that are having bedwetting. So a lot of times the pediatrician doesn't really have much in their tool belt to deal with that, because it's not an ache or pain type of issue. It's not a big like metal, you know, like
It's
a
not a
red
bacteria,
flag.
it's not a virus.
Yeah.
It's
There's no, you know, that they're not urinating at night because of a virus that's going on inside their system, more than likely. And by a lot of times they have a misalignment in the low back or the pelvis because kids play hard, right? They fall, they crash, they push those bones out of alignment, and getting a good chiropractic adjustment in that area can help reduce that or even eliminate it. So we are able to see kiddos with that kind of stuff. And well, those are just some positive signs that we see as their body starts to heal.
Yeah, I would like to talk about real quick too, since we're here and we're talking about low back, and our jam as pregnant and postpartum mamas is we do have that special training, which is Webster technique, that focuses even more on that low back pelvis area, because we have women who have a uterus which free floats in the front part, but you have ligaments that attach it to bones so it doesn't fully free float around your body. It kind of stays anchored. But those will change through pregnancy as well. So we do look at those structures. Remember, those nerves are going to those organs to help with bringing baby earthside and stuff like that. So we want to make sure that's balanced and has as less stress as possible as well during that time. So that's really important with like that low back area as well.
Yeah, absolutely. And yeah, we check that to make sure it's balanced so mom feels better and baby has as much space as possible to grow and to get in the positions that they need to in utero.
Yeah, exactly.
So all kinds of good stuff going on. The spine may seem super simple, but it does a lot of tasks, right? And posture does play a major role in that. So if you are someone that does spend a lot of time sitting at a computer or workstation, you will get a lot of compression in your low back based on gravity just pressing down on you, and most of that weight is absorbed all the way in the lower part because it's holding the weight of the neck, the upper back, and it then goes down onto this low back portion. So just a little food for thought.
Yeah. So if you're struggling with it, if you want some help, let us know. We're always here and open to helping you as much as possible. We always, as a reminder, if you're on, definitely on our Instagram, every Thursday we post different exercises that you can do to help move your spine and work on that like mobility between your chiropractic adjustments and things you can do at home. So we have lots of different resources for you as well.
Yeah, and I just like something I just thought about because we were talking about pregnant moms, and one reason we do see them a lot is because, like Dr. Mallon said, that uterus is free flowing, but because there is so much change that happens in that 9-month period, mainly happening in the front portion of our bellies, that will pull and put additional pressure on the low back. So a good example of this is if you're actually overweight. For each pound that you were overweight, we'll add 10 pounds of additional pressure to the actual joints in your lower spine into the disc in that area, which will increase pain and discomfort. So if someone's overweight, one good way to handle low back pain if it's consistent and flaring up is by dropping some pounds. So that's something to consider. And since when you're pregnant, you are adding that additional weight there, it can flare up that low back and that sciatic pain. And since you can't lose that weight when you're pregnant until the baby comes out, then this is a good way to manage that and to keep it back in line. And actually, one of our most recent pregnant patients that came in and got her first adjustment ever said that she slept for 13 hours after that adjustment. So that was amazing, because your body needs obviously to sleep and get the energy up to heal and to make sure you're getting ready to bring baby earthside.
Yeah, might as well get those Z's now.
Yeah, absolutely.
We'll see you next week.
Bye.